Good morning. My name is Joyce Coleman. I'm the Executive Director of the Vasculitis Foundation, and I'd like to welcome you to today's installment of the VF's Roadmap to Wellness webinar series. During today's webinar, if you have any questions, please submit them through the question box in the right-hand menu. We will have a Q&A session after Dr. Niazi finishes its talk, and we will try to address as many of your questions as possible. Today's speaker is Dr. Shehzad Niazi from the Mayo Clinic Tertiary Care Psychiatry in Jacksonville, Florida. Dr. Niazi is a consultant at Mayo Clinic and works with the cancer and transplant centers. He is board certified by the American Board of Psychiatry and Neurology in Psychiatry and in Psychosomatic Medicine. Dr. Niazi presented at the 2015 International Vasculitis Symposium in Jacksonville, and we are pleased to welcome him back to provide this information for patients to help them cope with their vasculitis. Dr. Niazi, welcome.
Well, thank you very much. And just to do an initial sound check, you can all hear me okay, Joyce? Is this loud enough? All right, wonderful. So thank you for introducing me, and welcome everyone to the webinar. I appreciate the opportunity to share with you guys over the next 30 minutes or so some means that you can use, some tools that can be utilized to manage the stress more effectively. My practice is a little bit different than a routine psychiatry practice. I primarily work with the cancer center and the transplant center, and the other component of my practice is that I work in tertiary care division, where I see individuals who have complex medical issues from our subspecialty areas, neurosciences, all our vasculitis patients, among others. So the principles that I'm going to review today obviously are the types of principles that can be used in dealing with other types of stressors as well. So let's begin with today's presentation. The outline is that it is going to be in 3 sections. The first section will talk about as to what the stress actually is, how it impacts us, and what it can do to our functional capabilities. Then we will focus on reviewing some tools. I will provide brief introduction and can go into more details in question and answer sessions if someone will have any specific areas that they would like me to highlight more. In the very end, we will discuss some of the key points, and we'll get to that. That hopefully will summarize the presentation for everyone as well. So the first thing that I want to submit to you all is that the way we conceptualize stress or distress is perhaps not very helpful. The reason for that is that for some odd reason, we all have gotten this into our heads that all type of stress is bad, which is perhaps not true. I want my patients to conceptualize stress as if they would conceptualize managing their blood sugar levels or high blood pressure. If you have a blood sugar level of 160, yeah, I mean, you need to do something about it, but that doesn't mean that you need to get it down to 0. You basically bring it down below 100, and same is the case with high blood pressure. In a similar fashion, not every anxiety, stress is bad. We have known since 1908 that a little bit of anxiety actually helps. It can improve the performance up to a point. So let's suppose that if I had this presentation due today, and I was not even least bit concerned about this or anxious about this, why would I stop watching a movie and actually get the thing together that I need to do to finish this presentation or prepare for this? However, if it gets to a point where I get so anxious and so distressed about it that I can't even stay focused on what I'm doing, then I have gotten beyond the point of diminishing returns where suddenly it has become a problem. In a similar fashion, the same thing applies to when you're dealing with chronic medical conditions, that you have to be concerned about it, but if it gets out of hand, then it starts interfering with a person's ability to deal with circumstances that they need to deal with. So they wanted people to differentiate between eustress, which is a little bit of anxiety that improves the performance, and distress, which is very problematic. If you think about the problems that are caused by these chronic conditions, it's basically a transactional issue. It's a mismatch between the supply and the demand. So the demand side of the equation is all the things that you need to deal with, all the things that are requiring that you cope with them. That can be your disease, that can be financial situations, that can be relationship problems, whole host of issues. And all of these are things that you need to deal with using the supply side of things, which is what type of resources you got to deal with the stresses more effectively. And if demand is more than the supply, then you get to a situation which is not a very good situation, and that's when you start having a problem with homeostasis, as we call it. And that's where the distress happens. Now, if you think about as to how people deal with the stressors, you recognize that not everyone responds to things in a similar fashion, because yes, you are dealing with the stressors, but the way you perceive the stressors and how you choose to respond to those stressors, they are very unique and individualized. And many internal and external factors have an impact on that. For example, the background, temperament. Some people tend to be more optimistic than the others. How much expertise you have, how much experience you have in dealing with those types of situations. Overall, how healthy you are you eating healthy or not? What is your educational background? And then there are some disease-specific conditions where if you have some hormonal imbalance, for example, if you suddenly start having lots of problem with your thyroid or adrenal glands, then the hormonal imbalance results in specific issues that are more biologically based. And then there are these issues as to how much help you have received, have you learned some specific techniques or not that allow you to modify your responses. And if the balance is right, you get to a stage where you're managing your stress reasonably well, and if you're not, then you start having all sorts of problems. One thing that I want to highlight is that when you're dealing with the chronic situation, there are factors that are in your control and there are factors that are not in your control. In essence, you are juggling many balls. And that analogy is relevant here because when you're juggling many balls, let's say if you have the capacity to juggle 6 balls and you are juggling 5 balls, I throw the ball number 6 at you, you struggle with that a little bit, but you're still able to, with some effort, juggle 6 balls. But if I throw a ball number 7 at you, then it's not just the ball number 7 that gets dropped, all the balls get dropped. So in other words, people are able to manage things up to a point, and suddenly something happens, and that could be minor as compared to the previous challenges that they have dealt with, but suddenly everything seemingly falls apart. And just like this guy who is juggling these balls while standing on top of an elephant who is on top of a ball, which in turn is on a tight rope, obviously there are factors that are not in this person's control. In a similar fashion, despite your best efforts, sometimes there are going to be situations where things just get out of hand. And the psychological distress is not without the problem. There's obviously an immediate impact of how you cope, but in the long term, people who tend to have serious psychological distress also tend to have more health conditions. Like, for example, they're 4 times more likely to have lung problems and twice more likely to have heart disease or diabetes. And if you look at the limitations in people's ability to do things, ADLs mean activities of daily living, the routine things that you do. Patients who have psychological distress, they tend to have a lot more difficulties with that than people who don't. So how is it that the stress causes problem for us? Well, it depends. It depends on the disease factors, what type of disease you have. In the vasculitis domain, as you know, that there's a wide range of types of illnesses that people experience. There are treatment factors. So the treatment that is used, for example, if someone is using corticosteroids, the steroids cause so many problems. If you are on immune modifying agents, then those medications have their side effects. So you have problem with the disease itself, and then you have the problem for the treatment that you receive for that disease. And then you have contextual factors. And those factors may mean, for example, that there's a medication that you respond very well to, but that's a brand name medication and it is so expensive that you cannot realistically afford that. So you go for the next tier option, which perhaps is not as good as the brand name one was, but at least is affordable. It also means that if you don't have, for example, transportation to get to your doctor's appointment, then you are more likely to not receive care in a timely fashion, and there are problems with that, so on and so forth. So none of these things, in other words, happen in a vacuum, and you need to consider those factors. If you look at just the vasculitis in itself, and if you look at the quality of life, I'm sure that it's not going to come as a surprise to any of you who are in attendance that it has impact on the quality of life, and it makes it worse. In particular, patients who have increased amount of pain, they have much worse quality of life, and they also score much higher on the depression, fatigue problems, sleep issues, and how much they perceive their symptom severity to be. In addition to that, as I mentioned, patients who are using corticosteroids, they tend to have a lot more problems because the steroids in themselves, independent of anything else, can cause neuropsychiatric side effects. And the neuropathic symptoms also impact the quality of life worse. So once you start dealing with a disease, early on there's hope that it will get done and over with quickly. When that doesn't happen, it's a bummer, obviously. And then once belief in that person's capabilities to control those symptoms on its own starts to go down, and once the treatments start to fail, in a sense that you try the first treatment and you have some guarded optimism with that, and that doesn't work, and the second doesn't work, or the third does not work, then it is kind of difficult to feel optimistic about the fourth round of treatment. And the reality is that with successive failure of treatments, when it comes to, for example, depression, the likelihood of response does continue to go down. When you couple that with the fact that now the chronic disease is having an impact on your ability to function and think clearly, it's not a good mix. And overall, it has a pretty significant impact on quality of life, which continues to go down progressively. And cumulative of all of this, once all of this gets to a certain point, it starts getting into a situation where you develop mood conditions that can become clinical disorders in themselves. So if you look at the vasculitis data, it's not too surprising that roughly 4 out of 10 people have some anxiety problems, and about a quarter of the individuals can have significant depression. And I want to mention this and emphasize this point here, that chronic diseases not only impacts an individual, but it has an adverse impact on everyone involved, and that includes your children, that includes your parents, depending upon the age group, all the people, loved ones, people who care for you, they also get impacted by your illness itself. If it is a short-lived illness, this is 6 weeks or 4 weeks long, then people cope with that differently. But when it becomes an ongoing issue, then it gets very complicated, because if you are unable to do the things that you were doing, someone else still needs to do those things, those tasks or role obligations, so simple things such as taking the trash out or doing the laundry, picking the kids from the school, and whatnot. All of that gets done by someone else, and that someone else tends to be your primary caregiver. And as a result, the caregiver distress is a significant problem just in itself. So what do we do about this? Well, there are things that can be done about that, but as I mentioned early on, that there are unfortunate situations in life where, regardless of how much effort you put into it, you still are going to struggle. The counterpoint to that argument is that, yes, if you were not trying to, yes, it is difficult, but if you were not trying to do those things, it would get even worse, which I know is a difficult argument to make, that it would be worse, but it actually can get that way. So there's some common principles of managing these types of challenging situations. The first thing is try not to do any harm. In other words, try not to add more and more things on your demand side of it. If you already are struggling with a chronic disease which is limiting your functional capabilities, perhaps it is not the best time to, let's say, start a house renovation project or start planning a wedding or something like that. Whatever it is, just try to control that a little bit. Then minimize the factors that make it worse. The example can be that, let's suppose that if someone has a stomach ulcer or acid reflux disease, and then they eat a whole bunch of pizza, and after that they immediately lie down, obviously it's going to make it worse. But if someone already has significant neuropathic pain and arthritis on top of that, and if they wear an ill-fitting shoe and then they walk 6 miles, well, obviously it is going to be more of a problem for them. So try to minimize the things that make things worse, and then do more of the things that make you feel better. And that could be socializing, that could be exercise, that could be a healthy diet, or any number of things. And then in the end, remember the serenity prayer, because the reality is that there are going to be factors that are not in your control, and you have to be very objectively and critically analyzing the situation and trying to differentiate among the factors that you can do something about and the things that you have limited control over. So that's where we get into this concept of resilience, that, yeah, I mean, everyone is going to be dealing with challenges. Everyone is going to deal with adversity. What matters is how you deal with that, how quickly you bounce back. So if you fall off the horse, so to speak, how quickly you dust yourself up and get back on the horse again. And that is a skill that some of us are better than the others, and there are areas in this that can be learned, and that's what we will talk about a little bit. So if you look at the resilience, one of the good books that have been written about the topic that I personally like, and I'll give you the reference in 3 slides, divides the resilience into 10 different areas. So there's a sense of optimism, which is that people believe that things will work out, how you deal with various different type of fears and how you adapt to that. How is it that you try to do the right thing most of the time? How is it that you use the spirituality or religion or faith or your moral code if you don't, if you tend to be agnostic or atheist? All of those things play a role in that. And very critical, how much of the social connectivity you have, how much support you have available. That's a huge asset. Number 6 is how is it that you learn from other people who have been there, done that, and perhaps done better than you did? How much physically active you are, how much body reserves you have, and that depends on the activity or amount of activity that you participate in, how much you are keeping your mental capabilities sharp by staying intellectually stimulated, and how flexible you are, because life is nothing but change, and how you cope with the change defines your response to those types of situations. And I think one of the more important thing is that why is it that you decide to do certain things? Why is it that we continue to live? What is our purpose in life? Which is more of an existential issue, but if you have some sense of purpose, and that sense of purpose can basically be defined at an individual level, it doesn't have to be at a very grand scale, but you need to have some why of life to be more resilient. When we talk about optimism, it's not the type of optimism that you become Pollyannish and naive about the challenges that you're facing, because obviously there are some real difficult situations that people are dealing with. So I don't want to imply that you have to have your head in the sand and ignore all the facts around you. When in fact, when we talk about the optimism, we differentiate between a blind optimism and realistic optimism. The blind optimism would be that you seriously underestimate the risk of a disease itself, or you overestimate your capabilities of dealing with that, and as a result do not prepare properly for that task at hand. The realistic optimism, on the other hand, has this attitude where it is future-oriented, where it reminds itself, or a person reminds itself that, you know, there was a time in my past, 10 years ago or 15 years ago, when I was dealing with challenges. I came out of it. It was a struggle, but I did it, and I'm very optimistic that I will be able to make things better. Maybe perhaps not 100% better, but maybe 15% better. They think that things will eventually work out. And to some extent, it is dispositional in a sense that some people are just naturally better at it than the other people. And at times, it is just situational in nature. There's sometimes, in certain situations, when it is not as anxiety-provoking, people are able to retain their sense of optimism better than some other situations. So the idea basically is to make sure that you're paying attention to the relevant negative information, but you don't get stuck on it. It's sort of like as if on your way to work or school or doctor's appointment that you got cut off by a person who was driving very rash. It's one thing to say that, man, I mean, that guy is a jerk. But it's another thing to just keep thinking about it and thinking about it for the next 4 hours. And obviously, it is going to have a lot more negative impact on your mental well-being. So the idea is to be aware of the problem that you're dealing with, acknowledge them, but then somehow they'll try to move beyond that. Fear is a very important issue here, because when we are dealing with conditions that are chronic and conditions that require ongoing interventions and conditions that either don't have a good prognosis or the prognosis is not very encouraging, then there are a lot of things that people get afraid of. And it is a problem in some ways. However, if you think about as to how it impacts us, it's not that you have to be completely free of fear, because far from it. People who have dealt with adversity and situations where they had a lot of things to lose and a lot of things to be afraid of, they have dealt with it a little bit differently. So Mandela has this quote that I really like, which is that I learned that the courage was not the absence of fear, but triumph over it. I felt fear myself more times than I can remember, but I hid it behind the mask of boldness. The brave man is not he who does not feel afraid, but he who conquers that fear. And again, the idea that I'm trying to present is that it is not that you have to completely eliminate the fear, but you still can try to choose the response to it. So the social connectivity is very important. They call it the TAP code, based on a technique that was developed by POWs, or prisoners of war, during the Vietnam War. And the thing that kept them going to some extent was how they were able to communicate with each other using different type of taps. So the impact of social connectivity or social relationships on life expectancy is known, but it's surprising that people who have very limited social connectivity are 2.5 times more likely to die in most conditions, even after you control age, gender, and health status, and you take those things into account. And the way it works is that if you have a significant change in your stress level, it ends up having an impact on what we call hypothalamic pituitary adrenal axis, or HPA axis, which changes some of the hormones, which results in immunological changes, which complicates the protective factors. In other words, it affects your immunity, and then it reduces the disease resistance, and that's why it has an impact on survival. The role models are critically important. For example, as a part of this foundation, I imagine that you get in touch with a lot of people who are struggling in their own ways. Some people just do a better job than the other people. So having some role models can be very helpful. And again, it doesn't need to be one person, because all of us have our own flaws. So you can decide that I'm going to deal with this situation like that person does, or I'm going to try to emulate what she tries to do in that type of a situation. And any number of things can be learned from each other. And sometimes you can learn from other people what not to do, so they can be your role models as well, that this is how I will not deal with this. If you get a chance, I will recommend reading this book. This book is written very elegantly and talks in more detail about some of these 10 core areas that I briefly reviewed with you. It is called Resilience. It is written by Dennis Charney, Charney. I've never met him, so I don't get any royalties from the book. I'm just suggesting this book, and there are other books available on the topic. This just seems to be better written than some of the other ones that I have read. The other related tool that can be used is mindfulness-based stress reduction, or MBSR, which has a theme for every day. For example, Monday is a gratitude day, Tuesday is compassion, acceptance as to how you deal with the circumstances, how you accept the reality, acknowledge them, and move beyond that. What is the purpose of life? Ability to forgive yourself and forgive others, to be able to celebrate the small victories that you have had in the past week, and to be able to reflect on Sunday to see what could have been, what should have been, but in a more productive fashion. The basic idea of mindfulness-based stress reduction is simple, and that is that just like a computer processes a lot of information in a similar fashion, our brain processes a lot of information. So whatever you put in it, it keeps working on it. And just like a brain, just like the computer, it does have some limitations. Like, for example, if you have many programs open on your computer and you try to open yet another program, you see that circle which tells you that the computer's capabilities are getting taxed. In those situations, you can obviously buy a new computer, you can shut down some programs, you can add more rapid access memory, which you can't do in terms of the brain, but you can try to use the same principles where you're trying to limit the amount of open files, as they call in mindfulness-based reduction, you have in your head going at the same time. And one more point that I will make, that just like a computer has software in it, in a similar fashion, our mind is the software for our brain. So the way we process the information has an impact as to what type of outcome we have. Like in a computer or a calculator, you enter some digits and some symbols and it can give you the answer because it has the capability of processing that information properly. But if the software was corrupted or it didn't have the software, then it won't be able to churn those numbers and will not give you a good result. In a similar fashion, all the information that we are processing, if we don't process it properly, then sometimes the responses that we have as a result of that are perhaps less than ideal. When you get stuck on those negative thoughts, where you are afraid of the possibilities, where you cannot stop thinking about it, we call them ruminative anxiety, where people go through these what if scenarios, what if this happened, what if that happened, gets to a point where people are unable to fall asleep or stay asleep or have very poor quality of sleep. They get tension in the neck and shoulder muscles right here. They get distracted easily. They have impaired concentration, attention. All of that is a result of this issue of ruminative anxiety, and not facing your challenges and trying to avoid the response to it is an unfortunate situation that happens. And sometimes people have what we call cognitive distortions, which is a fancy way of saying that the way they think about things is a little bit different than some other people would. For example, they catastrophize things. That something minimal happens and they think that it is going to be an unmitigated disaster. Like they woke up and the coffee machine was not working and they say, oh my God, look at me. I can't keep a functional coffee machine in my house. I'm a total failure. I'm not going to amount to anything. Look at me. I'm a poor mom. I'm a poor wife, or this, that, and the other. So basically, they start at one point, but they get so far away from it that the emotional impact of those things becomes a lot more pronounced. And in mindfulness-based work, it is called attention black holes, because when you're spending so much energy, psychological energy, on these types of efforts, then you don't have a lot of productive outcome. So here is a challenge, and the challenge is that you can be backward looking, where you are thinking about and dwelling on the things that have happened in the past, what could have been, what should have been, or worry about the future, where you say, oh my God, 5 years from now I will be much worse. Look at me. My problems, my illness started 2 years ago and I have declined so much. If this decline continued to be at this space, 5 years from now or 10 years from now, I would be in a really, really bad space. And if you get bogged down into that type of a thinking, then obviously the area which is getting impacted the most is the present, which is the only area, ironically, in which you can actually do something about these types of issues. If you want to learn more about the mindfulness-based stress reduction technique and how it can be used or incorporated into your daily routine, you can see any number of therapists nowadays who are doing this. Mayo has its way of doing it. Harvard has its another little bit modified way of doing things, and other centers basically follow the similar principles. But this book is a pretty good overview. Most of the places some can offer you a one-time consultation, but reading this book will be a good start. And if you need some extra help, you can always contact providers in the area, and there are more and more of the psychotherapists and social workers who now know how to do this. I will emphasize the importance of good sleep, because more than 8 hours of sleep and a sedentary lifestyle and less than 6 hours of sleep without exercise, they are both associated with the reduced survival of close to a year, 13 months and 14 months respectively. There seems to be a good spot, so it's a U-shaped curve. Less you sleep or more you sleep, it impacts your survival, and uh, but again, it's just a very individualized thing. The important thing is to make sure that you are getting good sleep. We teach this to all of our patients, and we highly recommend this. Uh, this is called behavioral activation and self-management. It has three core components to it, which is regular physical activity, social connectivity as to making sure that you're not isolating yourself, that you're interacting with people, you're out and about, and participation in pleasurable activities. A very common problem is that people have this notion that, yeah, I will do all these activities once I get better, but no, it's the other way around. You will not get better unless you did these types of things. And exercise I mentioned, they call it meditation in motion. It's very helpful because it releases endorphins, which is good for your mental well-being, and it is highly recommended to manage your burnout, and it has a positive impact on your mood. It is recommended that you do regular aerobic exercise and strength training together, about 2.5 hours of moderate intensity work in a week, which can be basically brisk walking, or some vigorous exercise per week can be done. And if you add some strength training along with that, it makes it even better. So now we're going to review some key points, which I hope will be the takeaway lesson from or takeaway points from today's presentation. I keep emphasizing this point, and I think it's worth repeating, and that is that sometimes, despite our best efforts, things are just too darn complicated. And even if you have an umbrella, the wind is so blowing so hard that it still doesn't work, and you get soaked. In a similar situation, at times the challenges are such that despite our best efforts, we are just not up to it, and we have to just acknowledge that. Since the functional impairment or the impact of the disease on our capability to do things, which is activities of daily living, or the activities that we do, such as financial management, executive decisions, different role obligations, there are multiple different factors that have an impact on it. The unique drug factors that you're using to treat your illness, the illness factor itself, the circumstances, the support that you have available, any barriers to accessing the healthcare, all of those things have an impact on your capability to do things. Since the factors are multiple in a similar fashion, interventions need to be formulated and conceptualized in a similar fashion. For example, a person can maybe help a patient out with filing for prior authorizations, or helping them out getting on the medications that are the tier of the medication that cost them less out of pocket, avoiding hospitalizations, arranging for some transportations, getting them signed up for a different insurance that has better coverage, and so on and so forth, addressing the caregiver burden issues, getting them connected with, let's say, local county health offices, and those areas sometimes have some additional resources available, making sure that the illness is treated as best as it can, or using some medications. And that is where I will just very briefly talk about the medications. The medications for patients who are distressed are both underutilized and overutilized. And how's that? Well, think about a fire. Let's suppose that it's very cold and you want to have a nice campfire. What do you need? You obviously need some raw material. You need some wood that is not so wet that it can't be used for a campfire. Then you need some way of clearing the ground and putting in there, sort of like a holding place. Then you need a spark or something that can get the light, the fire going. And even if you do that, if the wind is blowing too hard, and then you're not going to get a good fire. But if you can control all that, suddenly you have a pretty decent, very pleasing and comfortable making fire. Conceptualize the medication in a similar fashion, that it's a spark that can make good things happen if you provide the right circumstances and the right material for it to work. In other words, you can't just conceptualize medication as a panacea to all your problems, but it definitely has a role when used properly. And less is more in most of the situations, because patients who have complex medical issues, they're already taking so many medications that more medications you add, more risk there is of drug-drug interactions and the side effects. So sort of like this, the medication causes, let's suppose, a side effect that we try to fix with another medication, which then causes another side effect, and then another medication is put in place to counter that side effect, and pretty soon you're basically feasting on medication, which is nobody's idea of fun. When you have distress and it gets to a point where it becomes a chronic stress, and when it gets to a point where it is having an impact on your ability to deal with the circumstances, personal life, professional life, academics, that means something needs to be done. And do not delay getting help in those situations, because it will be otherwise like trying to run a marathon with heavy ankle weights on. It's challenging already, and I think one should try not to make it any more difficult than it needs to be. This is the analogy that sometimes I use, that let's suppose that if you're walking fine and suddenly you fell in a ditch. Well, at that point, if you are in a ditch, you can try to think about as to how you got in the ditch. Did you slip into the ditch? Did someone push you into the ditch? But the reality is that regardless of how you got in the ditch, now you are in a ditch. So as you think about how you got there, you probably are better served in trying to figure out how you get out of there. So once you find yourself in situations where you have complex medical issues and you have mood problems or psychological distress or what have you, yeah, I mean, I understand that there are a lot of things that have contributed to that, but you still need to be forward focused. You still need to try to figure out ways of getting rid of all that. And the last point that I would like to make is that we all can worry about what the future may entail for us. Nobody knows what's going to happen to us this afternoon, next hour, next 5 minutes, let alone 5 years, 2 years, or 3 years from now. Time is very, very precious, and if you're very worried that things would be really bad 5 years from now and you'll be miserable, guess what? You don't have to wait 5 years, because by thinking about it non-stop and ruminating about it, you are making yourself even more miserable that you're going to be if you are not focused on that. So sometimes we have to figure out a way to learn to live month to month, week to week, day to day, or sometimes even minute by minute, or one step ahead of the other at a time. And at times it is easier said than done. But if you do not work towards that, things will not improve even minimally. In those situations, it is important to recognize that sometimes progress is only going to be incremental. And I tell my patients that if something gets 5% better, that's better than 0% improvement or 10% deterioration. So you have to conceptualize it like that. I know a lot of these things are easier said than done, but at times people seriously underestimate their capabilities. And another common issue is that sometimes they fail to pat themselves on the back from time to time for the grace and the courage that they have shown while dealing with these very complicated diseases. So every once in a while you need to do that as well. With that, I will conclude my presentation, and I will gladly answer any questions that you guys might have. Thank you.
Great. Thank you, Dr. Niazi, for a wonderful talk. At this time, I would like to welcome Kaylin Young, the Network Manager for the Vasculitis Patient-Powered Research Network, to open the Q&A session. Kaylin, do we have some questions for Dr. Niazi?
We sure do, and several of them, it seems to be an important question for our participants today. And the first that's come up a couple of different times is it important to find a support group? Now, Dr. Niazi, I know that you talked a little bit about this at the beginning of your presentation, but the question seems to be fairly important, and I think our participants would like to know about why this is so, if it is important, and why is it so important to find a good support network?
Sure. So let me use an example. So there's a disorder called amyloidosis, like 1 in 10 million or so. and practitioners see that case like once in their practice or so. And we here at our Mayo Clinic have a clinic for that. So I've seen like, we see about like 100 patients a year or so. So when you have these types of conditions, sometimes it feels as if you are in it all by yourself, that you are alone in your suffering. And sometimes when you are able to connect with other patients who are struggling with similar situation, it can be validating. But more importantly, you learn a lot from each other. Doctors and healthcare providers who are working with you can tell you to do certain things and all that, but they're practical tips that only the patients can share in a very candid fashion with other patients. So the peer-to-peer learning is critically important. And at times, as I mentioned, you need that social support system to just get through the difficult time. It's not like that these people are going to do things for you that you were going to do on your own, but they can give you some good tips. They can sometimes are there for you. And sometimes the best a person can do is to hold your hand while you cry. And even that is very, very helpful. The other benefit of being a part of the support group is that you are able to then have these types of uh, presentations or forums where you can discuss some of these things at a larger level, which you cannot do if you're just by yourself.
Yes, that's great. Thank you. Another question that's come up is, and I'm not sure if you have personal experience with this, but maybe you could speak to, do you see a lot of strain on marriages and families, especially due to chronic illness like vasculitis?
Well, absolutely, because as I mentioned, the role obligation. So let's suppose that someone has a knee surgery done and the spouse knows that it is going to be very difficult the first week, then it's going to get a little bit easier for the next 3 weeks, and after 6 weeks of rehab, person is going to be fine. You're dealing with a stressful situation, you are doing more work than you were doing before, but it is time limited. Now imagine that situation never ending, where you just don't know how much another person is going to participate. Furthermore, if things are unpredictable, like for example, if you're dealing with a disease that has relapses and remissions and flare-ups, it's very difficult to plan. Like if I'm planning for, let's say, a hike in Grand Canyon rim to rim, that needs to be arranged a year and a half in advance. But if I don't have any idea how I will be dealing in, let's say, a week or 2 weeks or 3 months, you can't really arrange anything. You can't commit to going to church gatherings or going to a friend's, bachelor party or what have you. But the idea is that the lack of predictability and increased role obligations put a strain on it. So that's the contextual issue. Then you have the situation where sometimes if you're unable to work, you lose income, which has a negative impact on the relationship. Intimacy issues, a huge problem, an elephant in the room, where people are unable to do those things, and if you are miserable, then being intimate is not on your top 5 or 10 or 15 list of things to do. So then that becomes another issue. The spouses feel bad to even talk about that, but then they argue and bicker about small things that have nothing to do with it, and as a result, the relationship goes south. Yes, indeed, it has an impact on the quality of relationship that people have, and at the end of the day, remember, marriage is not a noun, it's a verb. You have to work at it, and if you are unable to work at it, it is not going to end up very well.
Thank you. So the next question is related in the sense that thinking about anxieties and about the unpredictability of vasculitis. So the question was, how can we work to determine if it is okay to stop taking anxiety medication in terms of the unpredictability of vasculitis?
So it depends on the previous history. So let's suppose that if a person has had a situation where they had pre-existing psychiatric issues, and then they develop a problem. In those situations, it is pretty straightforward that you basically need to be on maintenance therapy. In other situations, when you took some medications for anxiety, you got better, and then you got off of it, and the symptoms came back, and you did it again, and the same thing happened, and the third time the same thing happened, then it probably means that you're better off staying on maintenance dose. In those situations, you basically try to find a lowest possible effective dose that does not cause any significant side effects, and then you try to stay on those medications.
Okay. So then our next question is, how important is it to get a second opinion? So this one is kind of general and across the board, but one that can cause a lot of anxiety for patients, especially with those trying to determine a diagnosis of vasculitis.
Purely from the standpoint of diseases in this category, I think most of the good providers will tell you that they encourage patients to get a second opinion, because reasonable people can disagree about how best to approach a situation, and you get to get different ideas from different individuals, and then you can decide which one makes more sense to you. Now, there are different aspects of it. One is the diagnostic accuracy, where there should not be that much disagreement. It becomes more of an issue when you're talking about the nuances of the treatment, where a person might have seen in their experience that certain type of side effects are so problematic that you're probably better off not going down that route. But as it pertains to getting the second opinion, I think even getting a third opinion is not a bad idea. But at some point, if you keep hearing the same thing and you're just hoping against hope that someone is going to tell you something that the previous one didn't tell you about, probably is not very cost effective, or you don't have that much return on your investment at that point. But yes, second, third opinion are I think very, very important.
Great. So this question has to do with working and dealing with the stress of vasculitis and or how to cope with a flare while you are working, or dealing with the stress of vasculitis and how that impacts your job. So how to kind of mitigate, the stress and unpredictability of vasculitis while working.
Well, the first thing is to make sure that you have really good relationship with your colleagues, right? And remember, these things are reciprocal. So if you are there for someone else, then it is more likely that someone else will be there for you. So if you are given a chance and you're able to someone else out, that person is going to be more willing to cover for you at your work. That's one thing. The second thing is that the FMLA type of options are available to people, and you can try to use them prudently. And then the reality is that in the economic situations where the job market is such that there are many people who are lining up to replace you, then you're going to be on more of a thin ice. In those situations, I think the important thing is to make sure that your immediate supervisor is kept in a loop, in a sense that they know that you're struggling with a situation that has the potential to cause flare-ups, and from time to time there might be a situation where you will not be able to work as well as you usually do. So having an open communication channel is important. If the anxiety is acute and stress is such that it requires immediate attention, in those situations I highly recommend that you get on something that helps you sleep good at night. Having a good night's sleep is perhaps your best bet in managing your stress a little bit more effectively. To mitigate acute anxiety, certain types of medications which we don't really like but prudently can be used, and they are benzodiazepines like Ativan, Xanax, or clonazepam type medications, but you need to discuss very carefully with your doctor the pros and cons of using those types of medications. So in summary, you make sure that you're nice to your colleagues, that you have helped them out in the past, like you were there for them, so they're more likely to help you out. Keep your immediate supervisor in the loop to some extent, in the sense that they don't need to know the nitty-gritty of everything, but just need to know at least some outline of your problems. Use the FMLA when you can, and talk to your doctor about some of the symptomatic Band-Aid type treatments during the flare-up. And again, make sure that if you use those medications, that you stop using those medications when you're not having an acute spike in your anxiety, because then those doctors will be more likely to help you out. Otherwise, they will be very leery of just increasing the medications when you have never gotten off those medications when you had the flare-up. And I'm talking more about the medication that help you deal with the stress, not necessarily about the vasculitis medications per se.
Sure, sure. So this again is sort of related to employment and how to work with new employers. So the question was, do you need to tell your employer prior to starting a job? And how do you confront this after or before employment?
Well, if in most of the places would ask you if you have a condition that will interfere with your ability to do the job functions that you're getting hired to do. In those types of situations, my recommendation usually is to be honest about it, not necessarily try to sabotage it. Like, for example, I have some patients who tell me that they can't find a job, but the interview starts by telling them that, uh, they show up for the interview and then they spend like 15 minutes talking about all sorts of hospitalization and difficulties that they have had in the last year or 2 years. I mean, you need to be honest with yourself. Would you hire that same person if you were in that, if the roles were reversed? So you need to you need to be open about it, but you need to basically not stop talking about it. So you do tell them that I have this condition that has flare-ups from time to time. It's unpredictable, but I have been a good employee, and this is the evidence for that. And I will try to be very prudent as to how I use the time off. And a lot of people are in those similar situations themselves. Everyone has dealt with different type of adversities, and if someone is going to be such an obnoxious person that that person is going to completely hold that against you, perhaps you're better off not working for that individual. But I recognize that there are times when people don't have any options in those situations. Sharing as minimally it is required is reasonable, and you can use basically sort of like your own judgment at that point.
That's great, thank you. So this is a question that we received prior to the presentation when we were just advertising kind of that this is our next Roadmap to Wellness webinar. We had a couple of questions through our social media channels of people writing in about the use of mindfulness and what kind of resources there are available for them to download in terms of like meditations. Are there particular resources that you would recommend that might help them along those lines of mindfulness and working through their disease that way?
Correct. So just like everything, there's always an app for that nowadays. So there is indeed an app that can help you with the meditation part of it. But remember, I think it's important to conceptualize this, that just doing that part is not going to make you mindfulness. It's a full package. So either you can work with a therapist, as I mentioned, increasing number of individual psychologists, social workers are providing these types of services. So that's one approach. The second approach is that I mentioned this book by Dr. Sood, S-O-O-D, D as in David, and that book is about stress-free living. I don't like the title itself because it says stress-free. I think reducing the stress is more apt in that, and the book is written in a very accessible fashion. Majority of individuals, if they were to read that book, they will get a significant amount of information about this that they can then start incorporating into their daily routines. So I would highly recommend getting one of these books. And the other ones are written from Harvard. Kabat-Zinn, I think, is the other one who has written extensively about that. So any number of books are available, and they're all reasonably good.
Great, that's very helpful. Thank you. So those were all of the questions that we had submitted today. If there are any others from the audience, please feel free to submit them in the question box. But if we don't have any others, then I will go ahead and pass back to Joyce, and I think we'll wrap up from here.
Great. Kaylin, thank you very much. And again, Dr. Niazi, thank you so much for sharing your expertise and knowledge with us. We have recorded today's session and we'll make it available in the VF webinar library once we edit the whole video. We also invite you to join us for our next webinar, which will be on February 11th. Our speaker will be Dr. Augustine Lee from the Mayo Clinic. Dr. Lee is a pulmonologist, and his talk is titled Insight into Your Lung Tests. We hope you will join us for a future webinar. The webinars are held monthly, and we will be posting information on future webinars as the dates and times are finalized. If you have a suggestion for a topic, please contact the VF office. The Vasculitis Foundation is pleased to provide these webinars. If you are a member of the VF, thank you for being a member. We appreciate your support. If you are not a member, we invite you to join today. Thank you again for joining us for today's webinar. We wish you a happy 2016 and have a wonderful day. Thank you for joining us.